Welcome to the Wellnest Mamas podcast. We are committed to leading a sustainable lifestyle and making community connections. In a world where stress and chaos seem to be the norm, finding balance and fostering a sense of true well-being is essential.
Whether you are just beginning your holistic wellness journey or are already deeply dedicated to the practice, this podcast is for you. Join the Wellnest Mamas as we uncover the secrets to holistic wellness and discover the power of building a healthy community that supports and uplifts one another.
Sit back, relax, and get ready to embark on a transformative journey to leading a sustainably healthy lifestyle. We're glad you're here.
Hey everybody, welcome back. I am Wellness Steph.
And I'm Caitlin. And today we have a fantastic guest, Miss Jennifer Burleson, who is a licensed clinical social worker. Hi, Jennifer.
Hi.
Welcome.
Thanks for having me.
Yeah. So I feel like I've met you a couple times throughout my journey of living in Northwest Arkansas. Most notably, you were at the Bentonville Birth Services grand opening, and you had this incredible pop-up, it was, remind me the
Postpartum Support International.
Postpartum Support International. And I was just so excited to see somebody bringing a voice to that, because can be a hard time.
They're a great organization. They're actually an international organization, but they do tons of education and advocacy and training all around perinatal mental health. So I was basically there just sort of flyering for them and getting the information out. Yeah.
That's awesome. And then I got to invite you over to the Wellnest to do one of our nesting hour meetups, and we talked all about mental health, and I took home a really awesome tidbit that I don't know if you realize how much of a difference you made in my life. And that's why I was so excited when you agreed to come on the podcast, because I was like, it'll be just so fantastic to have this resource for all of our listeners that might be tuning in at home up at 2:00 in the morning with a baby. You never know. So tell us, how did you start your journey into mental health?
Okay, so I've been a therapist for quite a long time now, almost 20 years. Since 2007, I think, was when I finished my graduate program. So I had been a therapist in various settings for a number of years, working mostly in outpatient mental health, but kind of just general, whatever was out, coming through my offices, basically. It was very much a generalist practice, and I did that for a number of years. And then essentially I had my son and kind of got thrown into postpartum anxiety. This was way back in 2011, 2012. And there really were not a lot of resources. And so I kind of went from being flummoxed new mom to okay, I gotta put my therapist hat back on and figure out what this is all about. And so it was really more like 2014 when I really went fully into perinatal mental health as a specialty, and have been doing that ever since.
Wow.
Yeah. So
that's amazing.
Yeah, now I have a high schooler, almost high schooler,
wow.
which is wild.
They do that, yes.
Yeah. So I did my, I went to school at NYU, did their clinical social work program. And then, with social work, you do a graduate program, and then you do a lot of post-grad training. There's thousands of hours that you do over a number of years to really get fully independently licensed. And that's when you're able to work in a private practice setting. So that's what I've been doing since 2014. Prior to that, I was working in more community mental health, some hospital-based stuff, things like that.
That's amazing. So what is your pillars for how you work with patients? Is there a certain method to?
Oh, sure. Yeah. So my foundational training is in psychodynamic psychotherapy, which is essentially looking at kind of what are our unconscious or subconscious motivations for things that we're doing in our life that may be playing out in positive or negative ways, and sort of trying to bring those things to light so that you can make changes. Because the idea is that without awareness, there is no change. Otherwise, people will just keep repeating the same patterns, maybe from childhood, maybe from you had a bad relationship and now you're repeating that in your new relationship. There's all sorts of ways that can show up. And so that's essentially kind of how psychodynamic therapy looks at that. So that's my foundational training from my graduate program. But then beyond that, I've studied cognitive behavioral therapy, acceptance and commitment therapy, DBT, which is dialectical behavioral therapy, and I mean others. But there's a lot of different sort of methods, and try to kind of seamlessly integrate them so that it's, smooth for the client in terms of it's not like, okay, 1 week we're going to do CBT and next week we're doing this and next week, because that would be kind of jarring. But I would say primarily the psychodynamic and CBT are my two main
cool
methods. Yeah.
So, Steph, I know you have a little bit of background. Do any of those things sound familiar to you?
I'm like, they all. It's a new language.
Yes.
It's a new language. Absolutely. I love all of that. It's amazing. So, but you are in this season, or you've landed in kind of a passion for maternal mental health,
absolutely.
Is what I was reading when I was snooping around all of your bio and all of that. So, was that from having your child, and that was really, again, we say this all the time, this is the catalyst. Children are our catalyst into like this, our passions and all of that. So I find that. So you had your child,
it was really, obviously already having an interest in mental health, but going through that experience, becoming a new mom, being a super anxious new mom, and not really, it took me a while to grasp that, oh, wait, this level of anxiety isn't normal new mom worry. Like, there's something else probably going on here. And there wasn't. I mean, postpartum anxiety, as much as we talk about it now, 14 years ago, wasn't really even a term yet. Mm-hmm. And so I had to kind of go digging. Like, my doctors were like, oh, I think you have postpartum depression. And I'm like, but I'm not depressed. That doesn't resonate, right? So I had to kind of,
So what would you,
which was not fun.
For our listeners that are like maybe curious, like what would you say are, like at what point should you seek help?
As soon as you feel like something is off.
So any reason?
Yeah.
You don't have to reach a certain level before you can.
Yeah. The first inkling that you have that something may be off, just reach out to someone. We can do assessments. We may assess you and realize, like, you know what, this is actually just kind of normal adjustment stuff, and can make some recommendations for that. But it never hurts to, I think, reach out to someone and just ask, like, what's going on? Because I think people know themselves, right? Like, women know themselves, and they know when something doesn't feel right for them.
So if you're asking this question, go ahead and
it doesn't hurt to reach out to someone and just have a deeper conversation, basically.
My daughter and I were actually just talking about this because she was asking what the podcast was about. And I was telling her, and she said, well, did you experience postpartum depression or anxiety with any of us? And I said, looking back, I absolutely had postpartum anxiety. And it was the same thing. It was, there just weren't resources. I was probably like, well, I'm in this capacity working as a psych nurse before I had her, and so it was kind of like, but even back then, working in that capacity, it just wasn't something that was on the radar. Postpartum depression, absolutely, but we were just kind of grasping over that hump. So if I today were to be experiencing what I experienced back then, and I got a hold of you, what could I expect? Because I know that when you're in that headspace and everything, it's so intimidating and overwhelming. And in this world, we have everything coming at us. So maybe for the listeners, just to kind of have, read the menu first. What could they expect when they call you?
Yeah. So, I mean, I tell my clients, like, when they first come to my office, I'm like, we're just here to talk. Right? We're just having a conversation, right? And that's really the basis of what it all is. Like, it's a very structured, right? Like specialized kind of talk, but you're really just here to explore with someone and figure out what's going on. So that hopefully puts people at ease, so that they don't, feel like they're going to be analyzed or like, right?
It's not a judgment session.
Nobody's here to judge you exactly. Like, we're here to just try to understand what your experience is, basically. In terms of symptoms and things like that, like, we're going to do an assessment, we're going to find out what's going on. I always ask about sleep. That's one of the first things that we take a deep dive into, because that affects everything. So we're going to look at sleep, we're going to look at feeding issues, what's going on, in terms of that whole process with your baby, because that's a big stressor. And oftentimes a risk factor for, like PPD or PPA. So we're going to look at that. I'm going to look at your support network. Who in your life can we lean on? Who can help? Who doesn't? If you don't have a great support network, we'll figure out. That's where, like, your wellness group comes in. I want to get them connected to the community and other moms and, other people who really understand what that season of life is like, because I think that's so crucial. You got to have people you can talk to who are like, oh, I get it. You don't have to explain it to me. I just kind of get it.
Exactly. You're not alone.
No. Yeah.
That's the biggest thing.
Yeah.
That's so important. I'm really, really glad that you have that priority of community and connection.
Yeah. Yeah. I mean, it's huge. You can't underestimate it, because that is, in terms of risk factors, like lack of support network is a big one. And that's one of the things that I'm always kind of assessing for, and what's going on there and how do we strengthen that, and trying to make those connections happen wherever we can. I think especially in this area, it's interesting because a lot of people do move here for work, and they move here for, and they may move here for a job and they're pregnant and then they have their baby, and it's like, well, I don't know anybody here. And that's a really, really like a doubly hard season if you're adjusting to a move and then adjusting to a new baby. And so I find that I work with a fair number of moms who are coming to me and they're like, well, I just moved here last year. And so then we're kind of really figuring out like how to build that, or how to maybe even strengthen connections they have in other places, that even if you're not physically here, like how do we make that a part of your day-to-day life so that you don't feel isolated, because that isolation is huge.
That is so important. I agree 100%. Being a transplant, like I can relate to that completely. You don't have any support network. There's nobody. You have to go out and, really get in the mud and meet people in the woods. Yeah.
That's how I met 8 months Steph. Pregnant. Literally in the mud, in the woods. Yeah, I was 8 months pregnant when I moved here, so it was everything was rapid, and there was nobody. It was, which for the first few months I really, was great. Yeah. But
then after a while, the walls can start to close in, and you're like, I need to get out of the house. I need to be around other adults, other people, and that makes such a huge difference. And I think just I know for me, like one of the things that I kind of struggled with a lot was that sort of loss of autonomy, like feeling like I was in charge of my own time in that way, because you're at the mercy of like the baby's schedule for a lot of things and feeding and all of that. So that was something that I think I needed to get out and feel like, okay, I can be in charge. Even if it was like once a week, I was like, I have one thing, and like no matter what, I'm going to make sure I get there. Whether it was a breastfeeding group or like, a new moms group or something like that was like an anchor in my week, that I was like, okay, I can kind of revolve everything else around that helped a ton.
That's a great idea. I love that. And so just so you know, guys, once a month, you can come to the nesting hour at 10 a.m. Wednesday mornings. We have different leaders. Jennifer, we'd love to invite you to host another one in the future, in the May, June, July, and beyond. I really feel like people are craving this information, and you make it so easy to understand. It feels very approachable.
Oh, thank you. Yeah.
So do you have anything that you want to share with our listeners about where they can reach you, like your website, or what's the easiest way to contact you?
So definitely my website's the best way to get a hold of me, and that's my name, jenniferburleson.com. And on my website, I have at the top basically a link to schedule a phone consultation. So that's the fastest and best way to get a hold of me. Just schedule a quick 15-minute call, and I'll talk you through whatever's going on. And like I said, we may decide to start therapy, or it may be like, you know what, I think you would do better with these other resources, or, but we'll kind of try to figure that out in that brief call. And that's also a good chance for clients to make sure that I'm a good fit for what they're looking for, and ask any questions. And, that way when I set up that first appointment, it's like, okay, we know we're doing this, because I know that's the hardest thing, just getting to that first appointment. And I don't ever want anyone to like walk into a situation and then leave feeling like, well, that didn't work out, or that wasn't for me, and now they're even more deflated and more, right? So I want to make sure that if you're going to get to my office, like physically show up, especially if you're bringing your baby, which is a lot of work, right? It's like, we want to make sure it's a good fit, and that, right, it's the start of something, and not just like, oh, okay, well, that didn't pan out, and now I feel right.
It is challenging just doing anything, but that is nice that you have that get to know you moment. How long do you think it takes to really settle into therapy? Do you think it takes a few weeks before you get comfortable?
Yeah, for sure. I mean, those first few weeks is a lot of just kind of history gathering, right? Like just kind of trying to understand your story, your background, like all the different things that might be playing a part into what's happening in the here and now, right? We always say there's like the there and then and the here and now, and they're very much interconnected. So yeah, those first few weeks are kind of uncovering all of that. And then I'd say you really start to get into the meat of it around month 3 is where you've kind of gotten past that initial like get to know you stage. And now it's like we're really kind of getting into things. Yeah.
That's encouraging. It doesn't feel like it's forever. Like, oh no, we won't even start scratching the surface for months on end.
I mean, honestly, I mean, a lot of it depends on the client and what they want. I mean, that, you know, some people are like, I really just want relief in the moment. And so we work on that. And we do very specific kind of solutions focused things where we're, you know, going to be doing more problem solving and more coaching and things like that. Some people really want to do the deep dive into their past or their and they're working through some of those things. And so we'll go there. But it's a lot of it is the client kind of leading the way in terms of what they want and need. And so I kind of try to go with that as much as I can.
I like that.
Yeah.
And you left us with some pamphlets about some like quick reference guide whenever you did the nesting hour. And it is full of really great tips. And I do want to mention when I had asked a question the last time we were with each other, and I was like, well, what's the first thing that you can do if you feel like, you know, you're hitting this wall, maybe with depression or something like that? And you said, do a social media detox. And I was like, knife, cut, heart. I was like, oh, she's so right. But you are so right. Yeah. And I have taken your advice, and I have done extreme social media detox because I realized how much time it was zapping and not being productive. And I have felt so much better in this past 8 days that I have had my productivity streak. And so, because I kept thinking about it, I was like, you know, it's like you can lead a horse to water. You can, it's like, I was like, well, I should at least try that tip and just kind of see how it goes. See how it does. And that was really, really impactful.
Well, I mean, I'm glad you mentioned that because that is one of those things like clients are not always totally on board with it. It's a little prompting, but it is, I think, most often the thing that they'll say, man, I wish I'd done this sooner. Because it's just like a cleansing for your mind and your soul in a way that, allows you to really sort through and figure out like, okay, like what's really me in this situation? What is being triggered by what I'm seeing on social media? What's the comparison trap? Like all of that stuff that I think for moms especially is really tough in those, first weeks and months when you're just figuring it out and you're like, but this person says do it this way and they seem to do it that way. And like, I've got 50 methods of, and I'm so confused. Like I want them to get in touch with their intuition and their their kind of wisdom and that.
Get your baby.
That. Yes. That's it. Exactly. The knowing is inside. The happiness comes from within. Being present with yourself is a present in itself.
Yeah, and I think it does. It's like one of those things you think it's relaxing when you're doing it. You're kind of just zoning out, but you're really not. It's not really that relaxing, especially for anxious moms. Like I find more often than not, or I'll ask them this question, like they'll come into my office and they've got some worry that they're just like almost panicked about. And then, I'll ask them like, okay, if you hadn't seen that post, would that have ever crossed your mind? Right. And a lot of times it's like, oh, well, no, probably not. I wouldn't have thought about this random outlier thing we saw online. But it's taking up a ton of mental space. Yeah. So it's a good way to kind of distill down to like what's an actual worry for you versus what is just something that's been introduced that maybe we could easily eliminate.
Yeah.
Yeah.
That's awesome.
Was that the tip that
Yes,
you took?
that was the amazing tip. I was
sitting here
because I was like, that is hard. But it made me realize, like, I was, okay, that is a big influencer.
Yeah.
It
I mean, it is. And I think that's one thing that my clients would say about me is I will challenge you. I will push you. I'm not necessarily the therapist who's just going to like, repeat back what you want to hear. Like validation and empathy, all of that is important, but it's not everything. And I'm definitely the person who will say, okay, you said you were going to do that this week. What's going on? Like
accountability partner.
Yeah, exactly. So I think clients initially might not love it, but they do come to appreciate it after a while. Yeah.
That's amazing.
Yeah.
So any tips let's speak to the new mom out there who's up at 2 a.m. like we mentioned. Is there anything that we can leave her with?
Okay. So I think, in terms of just like quick and easy, like grounding techniques, because I think that was the flyer I left with you at the group was those grounding exercises, because especially for the anxiety, like our bodies get so caught up in our thoughts essentially, and we can feel almost those like panicky symptoms of like heart racing and clammy hands and like, our breathing, maybe we're getting hot, like all that stuff. So those grounding techniques are super helpful at just calming all of that down. So I would say one of the like kind of easiest ones to do is it's just called 5, 4, 3, 2, 1. And it's essentially just name 5 things you can see, 4 things you can hear, 3 things that you can touch, I guess 1 thing you can taste, and then what's the other sense? I'm forgetting the last. Smell, thank you. And maybe 2 things you can smell. You can do them in any order, right? But it's just to get you back into your body and not like, or get your body sort of more back grounded to reality of like, this is not an emergency. Like if I was really in trouble, I wouldn't be able to look around my room and pick out 5 things I can see right now. And so it just helps the brain to kind of get back online with the
That's
more
a really
rational,
good idea.
rational side of
and
things.
it's easy to remember 5, 4, 3, 2, 1, and it's your 5 senses. So if you forget it in the wrong order, it doesn't even matter.
Exactly.
5 things you can taste, probably like lunch, gum,
Exactly.
chocolate, ice cream,
all the good things.
Yeah, so exactly. It doesn't have to be done perfectly, right? It's just doing it is really the thing. And that's a super easy one, especially if you're finding you're kind of just like in that agitated, anxious
spiraling.
Yeah, like spiraling, like I just need to get grounded. That's a helpful one. And then, there's, I don't know if you can share. I'd be happy to give you that list,
we can.
If you can share it
we
with
can
your
attach a PDF or do whatever.
Yeah, because there's a bunch on there that are similar, but
it's really informative. It's like double-sided resource, and that's really what our goal here with the podcast is. We're trying to build that resource library for people. As we get customers coming in and saying, "Look, who do you recommend?" We can say, "Go listen to this episode." Please. There's some great tips. You can meet Jennifer, in a virtual space, But is there anything else you want to share? I feel like this has been so informational.
I guess, really the main thing is just if people are like questioning whether this is normal or not, just maybe, feel free to give me a call or set up a phone consult. I don't mind. I will happily walk people through whatever's going on and get them to the right place.
Because it's important.
Yeah.
It is. It's really
important.
And
it's, you don't need to go through this alone. Like there's so many resources and there's so many things that can be done that are effective, that are helpful. And, I feel like people tend to feel better sooner than they think they will, right? Which is the whole goal, right? That's the whole point. I want to get you back to feeling like yourself as soon as possible. Yeah.
That's amazing.
Wonderful.
Well, thank you
so much for being here. This was
Thank you for having me.
Yeah.
This was great.
Yeah.
Bye, guys.
Bye, everybody.